Okay, so get my notes up real quick. Okay. Alright, so this live is going to be about hydrotherapy, but mainly it's going to focus on hydrotherapy as an adjunct or a secondary modality in which you can improve efficiency of healing and to go alongside the usual physiotherapy. Now, the reason I chose this is because I've had a few clients that are coming in and thinking about other ways that they can get back to full fitness, and what are easy ways without having to break the bank of you getting that maximum efficiency of rehab. So we're going to talk about hydrotherapy as one of those. So mainly with hydrotherapy, you want to think about the different properties that, or the reasons behind hydrotherapy being a good thing. So obviously it's based upon submersing yourself in water and performing different types of activities such as muscle contractions or deep water running, which we'll get into a little bit later. And when we look at the property of water, what it refers to is the different things that within it. So you've got density, so because of the ratio between mass and space and the pressure in water, there's a different higher density than in normal air. You've also got buoyancy, which is like the upward thrust of water. You've got hydrostatic pressure, so the pressure of the water on your body, and what each of those can do and make it beneficial for someone with injury. So first off, if we're thinking about it in the acute phase, so as soon as someone comes as after injury, hydrotherapy is a great way to start off because of its use and benefits. One of it being the reduction of pain and swelling, and the restoration of range of motion as well as muscle flexibility, which is a huge problem when you're starting off straight after injury. So early joint movement is very beneficial to avoid contractions of the capsule, reducing swelling and pain, as well as gaining early full passive and active range of motion. And it has no negative effect on joint laxity. So joint movement is really important to get as much as possible, as soon as possible. But on land, it's you don't really get that because of pain, because of stiffness. And aquatherapy can then support movement of the body, and then lead to improvements in joint swelling and active range of motion, as well as passive. And then what you've got as well is the hydrostatic pressure of water. It aids in the removal of swelling. So if the water pressure is higher than that of blood pressure, this will result in fluid shifts, which therefore forces fluid out of a joint. So if you've got excessive swelling within the joint, it helps to force that out, as well as optimizing what's called venous return, so blood flow from the injured area back to the heart, and then also lymphatic drainage, which is the draining of the extra fluid that's left after inflammation. And as a result of that, the hydrostatic pressure is going to be great to remove these issues, which is one of the most important things that you want to do off the bat, is to help with the inflammation. So the hydrostatic pressure is linked with the depth of water as well. So if you're able to get a specific depth, so the depth of 120 centimeters, so just underneath the water, it is around the normal diastolic pressure. So that refers to when the heart beats or doesn't beat, diastolic pressure. So therefore you can get better blood flow, and improve pressure in the joints in that way. On top of that, you've got what can happen with water is it can help to desensitize. So if pain is the biggest issue for you in the early phases, then full immersion in the water means that pain is less and perceived to be less. The pain threshold is elevated, and it also, the reasons behind that may be down to skin, sensory, nerve endings being stimulated, and sensory overflow within water. So it helps to desensitize alongside the reduction in joint swelling, which, if we're looking at what we need to solve straight away, those are our two biggest issues: the pain and the movement. So another thing that's beneficial regarding hydrotherapy is the early implication of getting back to normal walking. So if we had a look at ACL reconstructions, you may not be able to, within the first weeks, even into months with poor physio, be able to fully weight bear onto your legs. So it then leads to functional deficits, and you want to get someone moving as fast as possible. But if they're just walking around in crutches, that's going to limit that. So as a result of this, if you can get yourself into the pool, have the buoyancy, take the pain away with the hydrostatic pressure, that then allows you to be able to walk a lot easier and a lot earlier, and therefore have more of a beneficial effect in terms of your long-term and overall rehab. So another aspect of that is you've got gait that gets affected. So there's an issue with gait patterns, so walking patterns immediately following injury is you are going to pick up limps, you're going to pick up poor gait patterns, and in order for you to re-establish that and to stop it from that seeping into your normal walking patterns, it's better to get that water to be able to start walking earlier, right? So that's what we were trying to do with walking in water. I see a message. So does the water temperature matter? Yes, it does. If you're looking at different types of water, in fact, I've actually got a picture here. Hold on. So what you can have as the different types of water, temperatures of water. If it's hotter, then it's going to have the same therapeutic effect as if, imagine you had a hot water bottle on an area of lower back pain, for example. So it's going to help with relaxation, help with pain relief. Pain relief, but the ability to move a lot more smoothly is what hot water is going to do, whereas colder water is going to help with reducing pain. So if pain is your biggest issue and the ability to feel less, then you want a colder pool. But if you want to be able to move a lot more freely and for blood flow to pump fast around the body, so this is slightly after the early phases of injury, you want a warmer pool. So yes, water temperature does matter. It entirely depends on what you're trying to achieve. So if you're earlier on, I would suggest colder water. If you're later on in recovery, then warmer water is going to help with the speed of blood flow. And that's quite a good point that you made just then. So going back to what we were talking about with walking, it can allow for more optimal walking practice. So you can achieve and re-establish normal walking gait due to gravity and lower body loading. You're welcome. Also, it's when you're trying to re-educate gait and walking, it should include selective movement retraining exercises that support retraining. So what the water does allow you to do is break down the movement a lot more. Because you have that a lot of support, you can go back to basics with it, if that makes sense. So you can really teach someone from the ground up a lot easier underwater. So if we're thinking about the benefits of water in the early stages, you've got hydrostatic pressure for pain, swelling removal, and desensitization for pain as well. and we've got early gait implementation as well. A third thing is your fitness, right? So that's going to straight away, as soon as you're injured, it's going to go down the toilet, right? Because you haven't been able to move as much. So if you are trying to preserve your cardiovascular fitness in someone, for example, who's very sporty and very active, you being able to get in the pool and swim is going to be a lot easier for you to do than go for a run. But you're also going to achieve a lot more fitness in that short period of time. So it's a really good thing to get started with is underwater running, which is one example we're going to give you. So if you're looking at underwater running, is good for preserving your aerobic fitness. The buoyancy, viscosity, and density of water means that you can allow for performance of cardiovascular exercise a lot easier, which will result in similar responses to land running, because you have to fight against that water. That's going to increase heart rate, etc. Also, it improves your max aerobic capacity from, if you're sedentary, in a sedentary position, you can only go up to about 40%, whereas with underwater, you're able to get that a lot higher as a resting. So it's very important to help with this by monitoring heart rate and the pool. So that's something that we can do to help with that. Okay, so if we're moving on to the specifics of the benefits, so if we had to think about the 6 benefits that we talked about, we go back to the start. We were talking about pain and swelling, as well as range of motion, recovery of walking, maintenance or development of cardiovascular fitness, improved motor pattern coordination training. We've also got 2 other things that we can do. We can implement plyometric training, which is running and not running, obviously in the pool, but jumping around that you would do on land. That could be good for the late stage of rehabilitation. What we can do is we can bring that in earlier, because you've got that buoyancy of water and the pain relief. You can do that a lot sooner with water and hydrotherapy than you can on land. So that's another aspect of why hydrotherapy would be good to implement within rehab. And then also on top of that, we're looking at recovery. So water, all the benefits of water, you have also in general a better recovery rate if you were to get in the pool and swim for a couple of times a week, right? So you have optimized recovery and optimized load management. So if we're going to put everything, all the benefits that we've got into one, we're looking at the main thing, the main reason why you want to start hydrotherapy and get yourself in the pool after injury is so you can do everything that you were able to on the land with a lot more efficiency, a lot faster rate of recovery, and everything is just a lot easier to do. So why would you not want to do that? So that's realistically the benefits on why we want to give it a go and implement it within our rehab. So definitely think about trying whatever you can within rehab outside of just general exercise. And if you have access to a pool, get yourself there, get started on that. Deep water running, just go for swimming, just get the joints moving, because you're always going to be better off doing that than being sedentary. And that's the really good thing with hydrotherapy that we can implement. And sure, there you go. So that is why hydrotherapy could be good for you. We'll leave that there for today. Okay.